Good evening and welcome to our COVID-19 update. I am Ladi Akiriduluale. Here are the highlights at this hour. The Nigeria Police charged luxurious bus operators for breach of COVID-19 protocols, including the nationwide curfew. Kaduna State government unveils incentives to alleviate COVID-19 difficulties as Kwara State cancels all Salah celebrations. And World Health Organization reveals a record day of COVID-19 virus infections worldwide. More than 15.5 million people are now infected. Owners and drivers of 15 luxurious buses recently arrested by the police in Lagos for violating curfew rules have been charged to court. The Lagos State Commissioner of Police, Mr. Kano Tax, who spoke with Channels Television, explains that all stakeholders in the transport subsector have been further warned against breaching such rules. You would recall that the 15 buses were arrested with over 150 passengers in the Alakwara area of Lagos earlier this week.
So those that are arrested now, they are charged to court. So at that level now, the fine they have now, so they pay their fine, they left. It's not only the bus owners or the drivers, including the passengers. So when we arrested this owner, we had 150 passengers there. It was on Saturday, so Friday night, early morning on Saturday. So, but those that are nursing mothers there, we know that there was no court on that Saturday. There won't be any court on Monday. So discretionally, so I have to. So the nursing mothers now, the aged people they are now, so others are charged to court. As a fallout of that we invited them to let them know that we are not just out for any punitive one. Some claim ignorance, which I know that in law, ignorance is not an excuse. But in order to have that the government is not out to punish them now. So we invited all the luxurious bus owners, operators. So where we have told them, and so many questions were raised, that if a bus takes off from point A, thinking that journey is going to last for about 3 hours to get to destination in Lagos here before the COVID time of 10 p.m. And along the line, there was an accident. Along the line, there was a breakdown. Along the line, so for one reason or the other, which is not predictable, and the vehicle have to be transiting. By the time it gets to Lagos now, it's already, I say, well, what happens anywhere that's 10 o'clock, where they are, they must stop there. That is the law. Because there's no anywhere that 10 o'clock, so that should be the area. So to stay till 4. Fortunately, the government has reduced it. Formerly, it was 6 in the night to 6 in the morning. So gradually, it was reduced to 8 to 6. So now it has been moved to 10 to 4. So let the members of the public know that the government is not out. So with intention of punishing the citizens. All what the government is doing is to reduce the spread of COVID-19 so that everybody go back to the normal life you are living.
Lagos State Commissioner of Police, Mr. Akinka. In Kaduna State, the government there has introduced COVID-19 tax incentives to reduce the effect of the pandemic on taxpayers. And that's in addition to other palliatives that it had earlier rolled out. The Executive Secretary of the Kaduna State Internal Revenue Service, Dr. Zaid Abubakar, today says the incentives will include extension of deadline for filing of tax returns, a waiver of penalties and interest for late filing of returns, as well as tax rebate. Dr. Abubakar also says that Kaduna taxpayers will be given grace periods for the payment of consumption tax by the entertainment and hospitality sector, payee by private schools, and for persons subject to presumptive tax. According to the Executive Secretary, the deadline for the filing of annual tax returns has been extended yet again, this time to the 30th of September 2020. And staying in Kaduna State, the government has sealed social facilities and hotels across the state for operating against its protocols for reopening businesses. The facilities were shut down by the State Ministry of Business, Innovation and Technology during an inspection of the facilities. In the course of the exercise, the enforcement team met customers eating in restaurants, bakeries, and drinking inside hotel bars, violating the guidelines for reopening, as only takeaway or room service was supposed to be allowed. Other violations by the hotels and restaurant operators include non-compliance with physical distancing, failure to install hand washers at the reception and other designated points, as well as a failure to use face masks. The Commissioner warns that government will not hesitate to deal with erring or non-compliance facilities who violate stipulated protocols for reopening the economy.
Quite a lot of people still go about business as usual. They go about it as if there was nothing happening. So there was a need to come out, or there is a need to come out as directed by the COVID-19 task force, which is chaired by the Deputy Governor, to ensure that people maintain and keep to these laws and orders.
In Kwara State, the government has announced the cancellation of the Eid al-Adha congregational prayers across the state, citing the rise in the state's COVID-19 cases and the danger of a large gathering worsening the situation. The government also announced a ban on vigils in churches and mosques, while restating the ban on concerts, clubs, beer parlors, and bars, as well as hotels. While briefing journalists, the chairman of the COVID-19 committee in Kwara State and Deputy Governor, Mr. Kano Tax Incentives, says the decision to cancel the Eid prayers was a painful but necessary one.
Speaking to journalists today, the chairman of the COVID-19 committee, Kano Tax Incentives, says the decision to cancel the Eid prayers was a painful but necessary one to save lives. He said the government is setting up a task force to ensure all the new directives, including new guidelines on transport unions and market associations.
Because of the huge numbers that are expected to gather for the special Eid prayers and the possibility of such gathering leading to spike in our cases and potential deaths, the government, in consultation with the Council of Ulama, under the Royal Highness, the Emir of Ilorin, Dr. Ibrahim Sulu Gambari, hereby cancelled congregational Eid prayers for 2020 cases across the whole states. This is a tough decision, but it was made in the interest of all of us.
The Kwara State shopping mall, the amusement parks, markets and the University of Ilorin Zoological Garden are to close down on Eid Day and the day after Eid.
We have met with the government, and so far
the Imam Imale of Ilorin, representing religious leaders, re-echoed the worries of the state government and called on the people to abide by the directive on Eid and other decisions that had been taken following consultations with the various stakeholders, including the Council of Ulama.
all the measures and preventive measures that will keep coronavirus off of our way and our town. We have seen it on the ground. And we commend the government for the efforts to hold meetings with all the stakeholders.
The State Commissioner of Police says law enforcement agencies are ready to implement the full compliance with the mandatory use of nose mask, and those flouting the law will face necessary sanctions.
The government has already given out the guidelines that we are going to follow from now on, which includes compulsory wearing of masks by everyone. Violators of this regulation will be arrested and prosecuted under the Kwara State Infectious Diseases Regulation 2020.
The government repeats, however, that markets are to be shut on the day of Eid and the day after for safety reasons.
In Bauchi State, the Deputy Governor, who also chairs the state's COVID-19 Task Force Committee, has flagged off the pilot phase of the active case search in communities across 3 local government areas of Bauchi, Karfi, and Bogoro. While doing this launch, the Deputy Governor also launched the distribution of 700,000 face masks to residents of the state.
I am in the multipurpose indoor sports hall, Bauchi, venue for the distribution of 700,000 locally made face masks to the people. This is a promise kept by the government. The modality for the distribution has been organized in such a way that these face masks will go to the emirate councils, institutions, groups, and associations. I am wearing one of the face masks that has just been distributed by the state government, and the deputy governor, who is also the chairman of the COVID-19 task force, says that quality and standard have not been compromised.
Distribution of the locally produced face mask is a very significant milestone in checking the spread of COVID-19 at the community level. And I will emphasize the wisdom of the Bauchi State government in choosing to produce this mask locally. The essence of it is that it can be used again and again and again. Introduction of this mask wearing and the participation or the given by the state government of this 700 plus mask, it has now become mandatory for each and every one of us to use mask in the offices and in places of interaction. Furthermore, the state government has directed the local government caretaker committee chairman to produce 10,000 face masks each and distribute accordingly. My understanding is that these masks have already been distributed, have been produced and distributed at the local government level.
This is a demonstration of responsibility by the state government, even though the population of Bauchi State is over 6 million people. People are expected to also show responsibility for personal safety. This will also make it easy for security agencies, of course, to enforce some of the safety guidelines. From Bauchi, Hajara Aliyu for COVID-19 updates.
Staying in northern Nigeria, but in Calabar State, where the government there has granted approval for the downward review of its 215 billion naira 2020 budget by 25% due to the economic effects of COVID-19. This was part of resolutions reached at the State Executive Council meeting held behind closed doors in Jalingo. The meeting, which was presided over by the State Deputy Governor Haruna Manu, also granted approval for the completion of the Jalingo Primary Water Supply Scheme, as well as the construction of a housing estate.
So the 24 cases are not that all the cases were recorded in a single day, but the cumulative of cases that have been reported in the last 2 weeks. That gives us a total of 24. And what it means is that we have commenced active case search in the community, because currently we have tested over 500 samples. And if you look at it statistically, we are having barely 50-something confirmed cases in Calabar State, as against the 500 plus samples that we have tested. And if you look at the statistic nationally, Calabar State and a few other states are the few states that have less than 100 number of confirmed cases in the country. However, we have told you our limitations in our previous briefing, that we are working hard to have a testing center in Calabar State. When we have a testing center, we are likely even to see more cases, because the pandemic is still ongoing, and this is just the first wave of the pandemic. We have not reached its peak, because there's a lot of community transmission. And out of the 24 positive samples that we saw, most of them were contacts of initial people that were tested positive. So when they follow up their contacts, they also were positive.
604, that's the number of confirmed cases of COVID-19 in Nigeria in the last 24 hours. 56.6%, that's 22,054. That's currently the total number of active COVID-19 cases in the country, just as 16,061 patients have been discharged and 833 deaths recorded. This brings the total number of confirmed COVID-19 cases in the country to close to 39,000. Lagos, the Federal Capital Territory, Abuja, Oyo, Edo, and River State continue to lead on the table of states with high COVID-19 numbers. They are followed by Delta, Kano, Kaduna, Ogun, and Ondo states, which complete the list of the top 10 states. So far, 256,038 samples have been tested in 58 NCDC-approved molecular laboratories across the country. In terms of demographics, the male gender accounts for 25,098. That's 64%, while the number of females affected stands at 13,850, which is 36%. Let's talk now to consultant public health physician, Dr. Duke Berkey, who joins us via Skype from the Amuwo-Odofin area of Lagos. Good evening, Dr. Akinka.
Good evening, Mr. Ladi.
Nice to see you once more. Let's take a look at what has happened more recently before we dive into the main part of the discussion today. There are states now which seem to be taking cognizance of so many of the things that public health physicians like yourselves had talked about earlier on. Sealing up people in terms of enforcement of non-compliance with COVID-19 protocols, and then large gatherings, including religious ones. Is it finally possible to say that the message is getting down?
Yes, I think we can say that at least it's something to be happy about, that finally the states are also taking charge of their own COVID-19 situations in their own states as well, and then encouraging their people to ensure that they are taking all the precautions. And then, of course, that very important part, enforcing, the adherence to these precautions. So it's a good thing. And I think they're taking a step in the right direction.
Moving on to enforcement itself now, generally speaking. Up until very recently, enforcement was not very popular. Most of the stakeholders wanted to avoid, talking about enforcement or actually going after people to enforce this. But it does seem as if, as things are, more and more people are agreeing that enforcement needs to be done now. What do you think has changed?
Well, I think people are realizing that if we don't take charge of this situation, then it's going to blow up in our faces, because they are not, the people that are not keeping to these precautions are not the only ones at risk. Everybody is at risk. So if we don't enforce it, then we're just talking. We're just making noise. So enforcement needs to be implemented, and it's good that that is being done now. And we know the way Nigerians are, many people may not want to do, what they've been instructed to do, just, so that they are not inconvenienced. So, but when there's enforcement and people know that there are consequences for these actions, if I do what I'm not supposed to do, then there will be consequences and I will face those consequences. It serves as a good example for other people. And so people would rather not go that way, and they would, comply. And that will help our COVID-19 situation.
Dr. Akinka, we're going to take a break in a second or two. But when we come back, I'm going to ask you about the vaccines that are currently in trial. Some of them within a year or within this year, some early next year will be available. So let's take that break. When we come back, we'll expand the discussion with our guests. Please stay on with us. Thanks for staying tuned. Welcome back to our COVID-19 update. Dr. Duke Berkey is still with us via Skype from Amuwo-Odofin area of Lagos. Dr. Akinka, before we took the break, I did say I was going to ask you about this issue of vaccines. So many have prayed and had hoped that this time would come much sooner than we are being asked to expect it. Some of the vaccines are being expected next year. Only the Chinese have said that theirs is expected before the end of this year. First of all, what do you make of all the results so far from these vaccine trials?
I think the results are quite encouraging, because at least we're seeing that there's progress. We're seeing that they're trying to get vaccines that will be safe, because that's a major thing when we talk about vaccines. fine, if the vaccine does what it's supposed to do, which is to keep you from getting the infection, or is it going to be safe? So once safety issues are also addressed and we can get a vaccine, then that would really, really help. So it's very encouraging. But of course, these things take time. They are not things that are done in too much of a hurry because of the safety concerns and the fact that you have to go through, the different trials, the different um, stages of the trials, so that at least we're sure that when we do get a vaccine, we get one that is not just effective, but at the same time is also quite safe for administration, and it's not going to be giving side effects that would make it almost useless, because nobody wants a vaccine that is going to make you sick. So it's very encouraging, and I'm glad that we're having such news.
We are relaxing restrictions on various things. People can go out now. There's debate over opening of schools. The domestic aviation has opened. But one of the things that people now talk about is international aviation. From the little that one has found out, this is a completely different ballgame. It is okay for you to say people must keep on their masks for a 1-hour flight from Lagos to Abuja, but when they are traveling 12 hours to the United States, it's a different ballgame to say they got to keep their masks on for that length of time, especially when they're not mobile. They're not being mobile. What do you make of the situation as we have it now, with the calls that international aviation should also be open?
Okay, well, international aviation has already opened in some areas already, some countries. You can actually travel out of your own country and go to other countries. But of course, before we can start to consider that and start to embark upon international travel, then we have to ensure that we put all of the required things in place to ensure that we succeed. Fine, we've started local travel, and that's a good thing. It's a good sign that at least we're making progress in trying to open the economy in that way. And then for international travel, since we have started the local one, then we can also step it up to the international one, but of course with lots of precautions. First, the people traveling in the first place, it has to be really essential travel for you to want to leave your country at this time. And then the airports and the airlines and all the people involved, FAN, all of them, the aviation industry in itself in Nigeria, they have to ensure that the regulations that they put in place, the instructions that are given, that those instructions are followed. Their staff need to be well trained in infection prevention and control. So, and I'm sure that is already going on, since they have already started local air transportation. So that should just, increase and then be also applied to international travel. And of course, it won't be to countries where coronavirus is not under control. So it will have to be to countries that they have that pandemic in their own country under good control. And of course, there would have to be testing, because people cannot just go on board an aircraft like that. So they would need to be tested to be sure that they are free from the virus. And definitely, they must be taking all of the precautions, all of those things that we know so well already now. Going there with their own personal protective equipment, wearing the face masks, and washing their hands, sanitizing when they cannot wash their hands, physically distancing, and then ensuring that even while they are waiting, for example, to board the flights, they are well distanced from each other. And on board the flights now, with most of the planes, the modern planes that we have, I believe that there is a lot of air filtering that takes place, as I have found, a lot of air filtering. So while the aircraft is in the air will be filtered. And so People, of course, will need to wear their masks, but at least that gives them some sort of sense of security that at least the air is being filtered. And then, apart from this, the traveler themselves or the traveler himself or herself has to take responsibility. If the person is ill, then that is not the time. You cannot be traveling when you are ill, right? And then, of course, they will be tested, and the testing must be quite close to the time of travel so that we are sure. And of course, it has to be testing that is definitely checking for the virus, ensuring that people are not taking the virus with them when they go on these trips. And so it's something we need to gradually plan for, ensure that we can implement it properly, and then learn from what we have seen now with the local air travel that has started.
Indeed. Thank you so very much, Dr. Duke Akinka, for your perspective on this one tonight. Do have a lovely weekend ahead. Thank you for your time. The federal government has not announced a date for the resumption of international flights, but some countries, as Dr. Akinka was referring to across the world, have resumed international flights, but with a lot of rules. For example, in the United Kingdom, only citizens from countries with low infection rates are allowed entry. Next, a report from our aviation correspondent, Bukola Joe Ketumbi, takes a look at two of the countries where flights have resumed.
This is the Dubai International Airport. Over 16.7 million tourists passed here in 2019. Now, a few passengers take advantage of the cautious reopening of the country on July the 8th to international tourists after nearly 4 months of shutdown. This sign here says it all. No certificate, no boarding. Visitors are required to wear face masks and gloves and follow anti-epidemic regulations of keeping social distance and checking body temperature.
Standards across every single touch point in Dubai, from hotels to the amusement parks, to restaurants, to retail outlets and everything else. So that again, everybody visiting any of these sites in Dubai will be assured and comfortable knowing that they don't need to worry about these things.
Now to the United Kingdom, where international travel opened up on July the 10th with the scrapping of an initial requirement for people arriving from dozens of countries to spend 14 days in isolation. Quarantine has been lifted for arrivals from countries deemed lower risk for the coronavirus, including Australia, Japan, France, Spain, Germany and Italy, but not the United States. The Gatwick Airport says it has put measures to minimize infection risk in place. Beyond masks, disinfectants and banners warning and reminding passengers to keep social distancing are seen everywhere.
Well, we put a lot of effort into particularly the hygiene and the sanitation of the airport. So as you can see, everybody at the airport are wearing masks. So we ask that everybody does that. We also have lots of hand sanitisation stations spread throughout of the airport and hand washing facilities. And we have perspex screens to protect our staff, but also to protect passengers. And we're doing very deep cleans of the airport with new technologies to try to minimise any risk to passengers and staff.
Here in Nigeria, domestic aviation has been up and running since July 8th, but it is characterized by low passenger volume as businesses, government services, among others, that drive traffic are not operating maximally.
We still have business not lots. We did a simulation or review of 15 companies on the Nigerian Stock Exchange and all the multinational companies in Nigeria. There's still restriction on travel for their staff. International airports are not open. 30% of our domestic passengers come from international feeder flights.
While government says it has no immediate plan to open up international travel, an analyst believes this sector should open quickly as the domestic dry run has set a template for what is expected on the international front.
We should be looking at the next 2, 3, 4 weeks. It's long overdue. Today, now who are those benefiting from this from the closure of international space are the foreign carriers who are operating the diplomatic and evacuation flights at exorbitant prices to the detriment of Nigerians and to Nigerian airlines.
Nigeria's international airspace has been closed since late March, but evacuation and cargo flights are operating as part of essential services. Bukola Jo Okitumbi, Channels Television News.
Let's talk to one of the aviation stakeholders, this time from the operational perspective. We're being joined via Skype from the Victoria Island in Lagos by Mr. Abiola Lawal, who is an aviation consultant as well as the managing director of flightboku.com. Good evening, Mr. Lawal. Thank you for your time this evening.
Good evening. Thank you very much for having me.
In the report that we just played, there is the question, or there was the issue raised about 30% of the passenger traffic on the domestic route coming from international flights. And the argument is that those international flights are critical to the viability of domestic aviation. What's your take on that?
Well, let me start by first of all, I mean it's a very important point. Aviation does not work in isolation. Aviation work as a continuum. So both the domestic and international work in tandem, one feeding off the other. So clearly, the point about the dependencies or interdependencies of the aviation value chain, from domestic to regional to international, is a very valid one. Having said that, I think we have to step back and say to ourselves, where are we today and where do we need to be? The road to normalcy, I think we're way on the way to normalcy. And that normalcy, I think it's going to be a new normal for everybody. But I think as a country, we should be very proud of what we have done in terms of our restart program. Domestic has opened. Nonetheless, we have seen relatively very low booking rates for the domestic sector. We know it's going to take some time for everything to catch up and integrate again. But there are a lot of checklists that needs to be had in terms of our health, in terms of the bilateral agreement with the countries we want to go and visit and the countries that want to come to Nigeria. The restrictions that are existing today, for example, with European country. So all these things have to be taken into consideration. But I would say that if we look at what we have done in Nigeria within the aviation sector over the last few months for the restart, I think we have done relatively well. If you pass through the domestic terminals today, you'll be very proud because things have been done very, very well. It's very well in terms of the standards.
But let me ask you, I'm sorry to jump in. I'm sorry to jump in and ask you, though, that the international flights are a different ballgame from the domestic flights. I was speaking to the public health physician before your interview, and we were highlighting some of the things that need to be done on international flights that may be less important, so to speak, for domestic flights, because most domestic flights are not as long as the international flights, and therefore the passengers are in the aircraft for much less time. And then there are protocols, as you pointed out, where those aircraft are going. So do you think that the sector is ready for that? The Nigerian aviation sector, particularly the airlines that do international flights, are they ready for this?
The short answer is yes. In fact, I will go further and say it's an emphatic yes. And I say that with all sense of responsibilities. I operate both on the downstream sector, which is the travel agency sector with flyboku.com, but also as an operator of the unscheduled aircraft operation in Nigeria. I can tell you, under the leadership of the Honorable Minister, because, sometimes we're all very quick to say what's wrong with Nigeria. But this is one of the areas what I think we should all be very proud, because the protocol and the standards that were developed by the Nigerian aviation sector under this leadership of the Honorable Minister and the DG, the new DG of NCAA, Captain Musa Nuhu, is a globally acceptable one. I mean, we were developing standards that ICAO, which is the global standards under the UN ICAO for aviation globally, was adopting and recommending and stamping. We had a lot of stakeholder engagement. In fact, the best I have seen over the last several years. So within the last 2 months leading to the reopening of the airspace of Nigeria, there were a lot of checklists that were done. All the airports we go around, you could see there's the right markings that were done. There were a lot of things that needed to be in place in terms of markings, sanitization of all the airports, and as well as the aircrafts. There's a restart program that we all have to go through, including my company. It doesn't matter how big your company is. We all have to go through a very extensive checklist, including your crew, your aircraft, your maintenance, your insurance, the ground operations, the airports. I mean, it is very thorough. On top of that, we then did a simulation program where we tested all this across the value chain. And then we didn't open all the airports at the same time. We opened them in phases, starting with Lagos and Abuja, I believe Kano, and then open it up over the last couple of weeks. So I believe the country has done exceptionally well and has become even a leader for the region, for regional aviation. So having said that, the issue of international flights opening is a very interesting one. You have to look at it from two perspectives. On one hand, I'm very excited and very eager to make sure this is open because it's affecting a lot of people in terms of their income. At the same time, you can't give what you don't have, i.e., even if Nigeria is ready to open to the rest of the world, is the rest of the world also ready to open for Nigeria? Don't forget that international travel, a lot of it has to do with bilateral agreements. You open your airspace to me, I open my airspace to you. You have to think about those things. But I will say that we have done exceptionally well as a country in terms of the standards that we have put in place. After all, if you look at what's going on now, there's a lot of evacuation flights leaving in and out of Nigeria. So
Thank you very much, Mr. Abiola Lawal, MD, flightboku.com, for your perspectives on that. State schools in South Africa will close for 4 weeks from Monday as part of measures to combat a surge in the number of COVID-19 cases. The reaction to President Cyril Ramaphosa's announcement is divided, as there are those who agree that the schools should be shut, but there are others who think they should be opened.
After weeks of heated debates and anticipation, President Cyril Ramaphosa delivered the speech he thought many would be happy to hear.
Cabinet has decided today that all public schools should take a break for the next 4 weeks. This means that schools will be closed from the 27th July and will reopen on the 24th of August. There are, however, some exceptions.
There are still many unaddressed concerns, but as expected, reactions have been mixed, even for those who stood together calling for the closure of schools over rising infection numbers. Weighing in, the South African Human Rights Commission described the latest closure of public schools as regrettable and unjustifiable.
Yes, absolutely. We stand by that. By 24 August 2020, over 10 million South African children, depending on their grades, will have lost over half or 100 scheduled school days as a result of school closures. So our position that schools should not have been closed is based on wide-ranging research indicating that school closures lead to increases in hunger and malnutrition. For many poor children, the meal they get at school constitutes a high percentage of the total food they receive daily. Secondly, it also points to an increased risk of child abuse, of rising rates of depression and anxiety, and children are at high risk of being left home alone when their caregivers go to work. In this regard, the announcement is not very helpful at all. There's also increases in inequality, since poorer learners and schools are least able to continue learning, and poorer children regress significantly as far as reading and math skills are concerned during extended absence from schools. We also note that independent schools will remain open, and in addition to this, in line with the current directions from the minister, schools can deviate from the dates for the opening of schools, and our own survey has shown that 43% of schools intended to request approval to deviate in this regard. And both these factors are likely to exacerbate the inequalities in education. On the other hand, we welcome the announcement by the President that the school feeding scheme will be resumed for the 9 million qualifying learners, in line with the North Gauteng High Court decision. This is very important, as a recent study by Needs Cram has indicated that 15% of respondents said that they reported that a child had gone hungry in their household in the last 7 days.
Dr. Uchamadi, who is an education consultant based in Johannesburg.
My worry is that there does not seem to be any structures in place by the government to ensure that learners from disadvantaged schools are in touch with teaching and learning during this period. While it is obvious that we cannot do much at this time, regrettably, government should strategically put in place a kind of teaching and learning continuity program, particularly for the disadvantaged learners at all levels.
While the COVID Command Council moves to provide clarity on what's been announced, the main opposition party, the Democratic Alliance, has headed to court to challenge the school's closure, saying that it perpetuates inequality and goes against scientific advice. On Saturday, ministers serving in the National COVID Command Council are expected to brief the nation with more details on the president's speech and government's further plans to combat the spread of COVID-19 in the country. From Johannesburg, South Africa, Betty Dibia, Channels Television News.
The World Health Organization has reported a record increase in global COVID-19 cases, with a total rising by 284,196 in just 24 hours. The biggest increases were from the United States, Brazil, India, and of course South Africa. Deaths also rose by 9,753, the biggest one-day increase since a record high of 9,797 deaths on April the 30th. More than 15.5 million people around the world have been diagnosed with COVID-19, while more than 633,000 have now died. India, which is nearing 1.3 million in the number of infections reported, more than 49,000 fresh cases of COVID-19, with 740 new deaths in 24 hours.
India has recorded its highest daily number of cases with 49,310 new infections. This brings the country's total number of cases to 1.2 million. India is the world's third worst affected country and is currently experiencing a rise in cases after relaxing some lockdown rules. South Africa is closing its public schools for a month in a bid to curb the virus there.
The next few weeks will put our resources and resolve to the test as never before. And I call on all South Africans to remain strong.
Welcome to our COVID-19 press briefing today.
The number of confirmed cases in the country have surpassed 400,000. More than 6,000 people have died. About 30 million people will be offered the flu vaccine this winter to reduce the burden on health services coping with a potential second wave of COVID-19. British Prime Minister Boris Johnson calls it the biggest ever flu immunization program. Meanwhile, new rules requiring face coverings to be worn in shops in England have come into force to help reduce the risk of a new pickup in the spread of the coronavirus. The Czech Republic is following suit and is making the wearing of face coverings at indoor events mandatory from midnight. The country currently has more than 5,000 people infected with the virus, the highest number since the start of the pandemic. In other countries in Europe, such as Germany, Spain, Italy and Greece, it is already compulsory to wear face coverings inside shops. And finally, in Germany, people who return from high-risk countries will now be required to take a coronavirus test at the airport. Anyone who can't show a negative result, including people who refuse the test, will have to go into quarantine for 14 days.
Wearing a face mask on your chin is not in compliance with COVID-19 protocols. So spread the word, not the virus. Our website, channelstv.com, has more on all of this, the latest on COVID-19, as well as regular updates about the spread of the virus worldwide, in addition to stories on other topics, politics, health, sports, and business. That's the COVID-19 update. Thank you for watching. I'm Ladi Akere Doluale. Stay healthy and have a good weekend ahead.